Welcome to the Sanilac Medical Control Authority CPAP training. Today we're going to be going over the Pulmodine O2 rescue system and its uses during respiratory distress. This is the 50 psi connector for the Pulmodine O2 rescue system. It can be connected directly to a 50 psi output or placed on a flow meter capable of producing at least 15 liters per minute. Just below the 50 psi connector is the fixed flow generator with filter. This allows filtered room air to come into the CPAP and mix with the oxygen, giving you about a 30% concentration on 15 liters per minute. Attached to the fixed flow generator is a 72-inch corrugated anti-asphyxia circuit. This is where oxygen and room air are mixed and stored under pressure for supply to the CPAP mask. At the other end of the 72-inch corrugated anti-asphyxia circuit lies the O2 CPAP valve. These have snap-on, color-coded, preset valves to adjust your PEEP pressure. Now we come to the CPAP mask, complete with adjustable Velcro straps and an adjustable forehead pad. Inside of the O2 CPAP valve is a small flutter valve. This valve should open when oxygen is supplied. This valve must remain open during inspiration. If this valve is dropping closed during inspiration, this indicates that the O2 flow is not high enough, and the system should be checked for leaks or oxygen increased. This is the pressure valve. Notice with the oxygen running and a hand placed to seal over the mask, the valve lifts slightly. This is normal, as it is allowing pressure greater than 10 millimeters of H2O to release from the mask. This is the adjustable forehead pad for the O2 CPAP valve mask. You simply squeeze together the two tabs and slide it in, out, up or down, and adjust it for best comfort and fit. Attach the 50 psi connector to a 50 psi outlet on your O2 tank. After it's attached, you simply turn on the oxygen and O2 should be flowing through the unit. There's no need to adjust the flow meter, as this is a direct connection to the tank. Fully extend your corrugated anti-asphyxia tubing and place it onto the mask. Then the mask should be checked that there's a flow, and check the unit, make sure there are no leaks. Here we see a 50 psi adapter used on a flow meter. Simply attach the adapter, adjust the flow meter to 15 liters per minute, place the mask on the patient, and observe. If the small flutter valve inside of the pressure valve does not stay open, you must increase your O2. Remember, when using a small O2 tank, oxygen only lasts for 2 minutes using the CPAP. Now it's time to place the mask on your patient. Initially, have the patient hold the mask to themselves. This allows them to get used to it. Frees your hands for applying the mask. Clip the mask straps to the side of the mask to secure it. Then you simply adjust the straps with Velcro and adjust the head bridge until you get a comfortable fit. After this is on, ensure that there's a good seal and no air leaking. Also assess to make sure that the orange valve is opening and not closing during inspiration. Although the primary use of the CPAP is for CHF, studies have shown that there's no harm done and some improvement in patients with asthma, COPD. For this reason, it may also be necessary for you to administer breathing treatment. Any standard nebulizer with a reservoir tubing can simply attach to the corrugated tubing and to the mask and attach to an O2 supply, and the nebulized medication will be delivered to the patient through the mask. Remember, it's important to monitor your patient's O2 saturation and respiratory status. As with any airway treatment, continual assessment is very important Be sure to monitor the EKG. Remember, CPAP is used on patients with severe respiratory distress in the hopes to avoid the need for intubation. CPAP is not a replacement for intubation. Constant monitoring of the patient for good respiratory status and the need for more aggressive airway treatment is needed. Once you start CPAP, it should not be discontinued. However, the mask can be lifted for short periods to administer oral meds such as nitro, aspirin, or prednisone.